Hi everybody, and welcome back to our channel, Four Nurses with a Podcast. For those who are tuning in for the very first time, we are a group of 4 nurses from all around the globe who like to come together and discuss kind of the up-and-coming topics in the healthcare sector. And this week we are discussing the hot topic of coronavirus, also known as COVID-19. Hi guys, my name is Lauren. I'm a registered nurse currently working at the Valentino General Hospital here in Italy on the medicinal rehabilitation unit. But yeah, let's get right into it. What is COVID-19? What is coronavirus and what does it look like? So besides COVID-19, there are 2 other known coronaviruses, the first one being SARS, or severe acute respiratory syndrome. The second one is MERS, or Middle East respiratory syndrome. And the World Health Organization classifies these viruses as being zoonotic, meaning they are transmitted between animals to people and vice versa. So SARS originally came from a few different species of cat, and MERS came from a few different species of camel over in the Middle East before infecting humans. In the case of COVID-19, researchers have said they believe it's coming from a species of bat or the pangolin, maybe both, but we don't know for sure where COVID-19 originated from. The name coronavirus does not actually come from the beer, but instead the Latin word corona, which means halo, and that's just due to the way that the glycoproteins have arranged themselves on the virus itself. They've arranged themselves in a way that makes the virus under a microscope look like it has a halo around it. But these glycoproteins are actually super important for how the virus functions. The virus binds to the superficial cells of the ciliated epithelium of the upper respiratory tract, and COVID-19 will only develop in the respiratory epithelial cells. When human cells or animal cells are damaged by COVID-19, what happens is inflammatory mediators are produced, and this leads to inflammation and swelling, causing the symptoms associated with the virus. When human cells are infected with the virus, what happens is they will sometimes show cytopathic effects, such as the development of syncytia, or multinucleated group of infected epithelial cells. These cells are ultimately not working in the manner that they should be, and most cells of the syncytia, or all, will eventually die. And yeah, so I believe I am now going to pass the spotlight over to Sarah.
Hi guys, my name is Sarah Ng, and I'm a nurse that's currently working in Wuhan, China. And now, as many of you guys know, aggressive quarantine and containment measures have already been in place, and thanks to them, the number of new COVID-19 infections that are being reported here have been declining day by day. Now, unfortunately, we know that this has spread outside of China and to many countries around the world. And as we know, it is currently labeled as a pandemic, and there have been new hotspots that have been popping up and countries that are scrambling to try and limit the spread of the virus. So I will be talking about the most updated assessment findings and symptoms that present if someone is infected with COVID-19. So as previously stated by Lauren, the virus does infiltrate the respiratory cells in your body. So the 3 most common symptoms that people usually experience is a fever, a cough, mainly a dry cough, as well as shortness of breath or difficulty breathing. So if you develop these symptoms, it is very imperative to contact your public health unit as well as your primary care provider. And you also want to be self-isolating at home as quickly as possible. And it's also important to remember not to visit your local emergency room or hospital unless your symptoms turn very severe or it is advised by your healthcare provider or public health unit to do so.
Hi everyone, my name is Rachel Rodrigues and I'm a registered nurse here at the Ridgeback Hospital in Washington, D.C. So today I'm going to be speaking a little bit about the common complications of COVID-19. So as you probably all know, there's been a lot of talk and misconceptions about the coronavirus. This is a complication in the healthcare field because there's a fear in the public, which ultimately makes it harder as healthcare workers or just in general to be able to push this awareness of taking precautions rather than entering a fear or panic mode. And when people go into this panic mode, it basically creates a ripple effect in the society. A consequence of this ripple effect, specifically in hospitals, would be that currently we have a very limited resource of personal protective equipment, such as gloves, gowns, and masks. And as healthcare workers, this makes it really difficult, whether it's doctors, nurses, or whatnot, it makes it very difficult to come into work and be able to do our jobs without the proper resources because of the high demand of society. And the coronavirus is basically known to be transferred person to person through droplets. So if someone's sneezing, coughing, things like that. And this basically means that the virus is very easily transmissible between person to person if the right precautions are not being taken. So with that being said, those are some of the most common complications with coronavirus as of now. And now we're going to switch over to Lauren, who's going to talk more about the medicine and the vaccine aspect of the coronavirus.
So unfortunately, there is no known cure as of yet for the coronavirus. We don't have any antivirals available to treat the infection, and there's no vaccine for it as of yet, although there is a global effort in developing one. Within the past few days, actually, in Ontario, Canada, researchers from McMaster University, University of Toronto, and Sunnybrook Hospital in Toronto have isolated the virus, and that is a huge first step because this will help scientists learn more about the virus and how it acts. It'll help them develop diagnostic testing, and also will lead them to the development of a vaccine. Now, of course, developing a vaccine is a very lengthy process, and the next question is, when are we going to see this vaccine? Unfortunately, nobody knows. We do know it's going to definitely take a few months at the very least. It could be a year, it could be more. It is so hard to say. And then there's so many questions that come with that, is how safe and how effective, how affordable will the vaccine be? So many different questions. We will not know until later when the vaccines are actually developed, but that is currently, even though we're in the beginning stages, we're currently making progress, which is good. So because there's no cure, populations are being advised to simply treat the symptoms as of right now. So that includes the dry cough, runny nose, fever. So that can be used with antihistamines, fever-reducing agents, decongestants, ibuprofen, acetaminophen, Vicks, products like that can help people feel relief if they are infected with the COVID virus. And I believe my colleague Rachel has more to say on this topic.
Hi everyone, so as Lauren mentioned, I will be speaking about the labs and diagnostics in association with COVID-19, also known as coronavirus again. A diagnostic test for coronavirus is very specific to certain factors. This includes whether the individual meets the criteria for a person under investigation. Another aspect is if they have a travel history, and they specifically look at the location and time of the travel. Another factor would be exposure history of any other person under investigation. They also look at clinical manifestations such as coughing, fever, all that kind of stuff, and just making note of the kind of symptoms that the individual presents with. The last one, which is kind of variant, is the specimens that will be collected. So for patients who are not admitted to the hospital, for example, somebody who comes in through the ER, the emergency room, they would say that a single respiratory tract specimen would be accepted for the COVID-19 testing, whereas someone who's an inpatient, it's recommended that there's a minimum of 2 swabs from 2 separate different locations. For example, maybe a sputum collection or a throat swab. Actual testing for positive coronavirus is done using a real-time polymer chain reaction, which is basically the count in the amount of DNA or number of copies of a gene that is present in the sample. So in this case, it would be the amount of coronavirus present in that sample. With that being said, I hope you all are taking the appropriate essential precautions to stay safe. So I'll leave you guys with that, and now we're going to go on to Lydia, who's in Canada, who's going to speak a little bit about their response to coronavirus on their end.
Thank you, Rachel. I'm Lydia Young, an RN from Toronto, Canada, and I wish to discuss how nurses in Toronto and across Ontario are responding to the current pandemic. Toronto Public Health is monitoring the positive cases of COVID-19 in Toronto, which is currently at 76. The virus is not currently circulating locally in Toronto nor in Canada as a whole. Nevertheless, with the current global situation, Toronto Public Health states that they are actively working with city and health partners in effort to plan preparations for the possible spread of the virus locally. The CNO is reminding nurses that we are accountable for making decisions that are in the best interest of our patients and for protecting them from harm and infection risks. We can do this by applying and teaching hand hygiene protocol, choosing appropriate measures to prevent and control transmission, such as wearing the correct PPE for droplet precautions, understanding your workplace's organizational policies about infection prevention and control, and using official sources of evidence to inform your nursing practice. It is vital that all nurses understand and involve precautionary measures into their practice in order to lessen the risk of self-infection and infecting others such as patients and colleagues. And that's everything from me about how Canadian nurses are responding to the current pandemic. Now on to you, Sarah.
Hi, I'm Sarah, and I'm here back again to talk about something that I think is important to talk about. And it's currently about the racism and xenophobia that's currently occurring due to the spread of the virus. So as it is known, COVID-19 was first discovered in Wuhan, China, and that is where the first major outbreak occurred. Unfortunately, this finding has led to increased xenophobic behaviors coming from many people around the world. And social media has played a big part as misinformation is very prevalent and still spreading. And I've also heard personal accounts from friends and family who are of an Asian background and have stated that their presence alone have brought upon dirty stares and inappropriate comments from others. Asian businesses as well in general have experienced drastic changes as the panic surrounding the virus has caused many to stay away from Chinese or Asian restaurants as well as grocery stores. So I think it's very imperative to understand that the only connection that the Chinese or Asian people have with the virus is that it originated in China. It's even more abundantly clear as of now that just because someone is of Chinese or Asian descent does not mean that they have the virus. And it has been clear that this virus knows no bounds, as we know that it is currently infecting people all over the world from different countries. And as someone who is of an Asian background, I just want to note that it does cause pain for me to see what panic can cause and how some people use the virus as an excuse to fuel their racist or xenophobic views. But the most important thing that I want to emphasize are the resources that are reliable and evidence-based, such as the World Health Organization and the Center for Disease Control in the US. So these both have excellent resources that are available for the public, including daily updates on the virus.
Now it is time to wrap up this week's episode with how climate change can affect emerging infectious diseases such as COVID-19. The last 30 years has witnessed an eruption of environmentally related illnesses and an increase in their prevalence, incidence, and geographical distribution. We have already observed instances where climate change has had an influence on infectious diseases carried by animal hosts or vectors in China. This occurred as warmer winters caused a species of tropical freshwater snail to increase its range, which increased the spread of bilharzia, also known as snail fever, to northern areas of China. As the climate increases in temperature, this allows viruses to change on a genetic level by adapting to warmer environments, which has the ability to make them more hardy and able to reproduce at even faster rates. This undermines our body temperature, including at times of fever, as a defense mechanism. There are many climate-related factors that can influence human susceptibility to infections, such as malnutrition due to climate stress on agriculture and an influx of ultraviolet radiation, which has the ability to affect the human immune system. Once our current outbreak is under control, it is vital that we understand how climate change is an influential factor of the emergence and distribution of infectious diseases to further develop preventive strategies. And that's all from me for today about how climate change can affect emerging infectious diseases such as COVID-19. Thank you for tuning in to this week's episode of 4 Nurses with a Podcast. But it is time for us to tune out. Make sure to join us next week when we come together to talk about the legalization of cannabis and any important COVID-19 updates. Bye guys.